science have to tell us about it? And how can we hold on to our hair for the longest possible time? I am Dr. Arvind Poswal, Dr. A's Clinic, Delhi, India. So, I know a lot of people have been told by doctors for a long time that our testosterone and DHT, dihydrotestosterone, is the cause of our hair loss. And in the market, you find a lot of medicines also. We basically say that they will reduce dihydrotestosterone or DHT. However, if it was so simple like that, then everyone would have been having hair. No one would be bald. None of the doctors should be bald at least. They can afford all the medicines that are coming in the market. So modern genetic science has something else to say about hair loss, the real reason behind hair loss. So let's examine it. One of the things they say is that hair loss is genetic. So in my clinical practice, in my ongoing clinical research also, we have been following people over multiple generations. And what we have noticed is something very simple but surprising. Like people come to me now, young people in their 20s, someone is 20-year-old, 21, 25, and they are sometimes almost totally bald. So they come to me and one thing they say every time, I lost my hair at a very young age, whereas my father, he was also bald. My grandfather was also bald, but they started losing hair when they were 30 or 35 or 40. So what is the mystery here? If a thing is genetic, it should be occurring at the same time. There is something else at play here. So modern science, when they were doing all the research in the field of age reversal and anti-aging medicine and gene therapies, then they found that hair loss is not only because of DHT. Let's use logic. If it is only because of high level of testosterone and therefore DHT, then what you would notice is that most people would turn bald when they are somewhere around 18 years of age. Because that is the time when you have the maximum spurt in testosterone. And naturally DHT would also be that much more effective on the hair. But it does not happen that way. In fact, neither do you get diabetes or heart attacks, even though you eat all sort of sugary things and all fat, everything. So what is happening at that time? At that time, our body's protective mechanisms, also called the sirtuins, they are at work. The body has an energy currency called NAD. A high school science, if you remember, they used to call this term NAD. So the sirtuins use the body's energy, NAD, and they repair the damaged tissues all along as we are young. So we do not feel any of those negative effects. But as we age, then those defenses become weak. The sirtuins are still there, but the energy or the NAD gets reduced. Now that reduction in NAD, what it leads to, that sirtuins, they'll go to the most important organs to save life. If you get infection, it will go straight away. Recent times there was COVID pandemic, it's still there. So what do we find in that? People get ill and they lose a lot of hair. Remember, here two things are playing in conjunction. One is our hair. Our hair is the fastest growing organ of our body. It needs lots of energy, it needs lot of nutrients. But if a body is suffering from any illness, stress, or it's bad nutrition, pollution, or even stress, mental stress also, not just oxidative stress from outside, even any type of stress, all these things, they actually damage the hair in a different way. They reduce the NAD levels. They do not provide the necessary nutrients to the hair follicles. And hair follicles have a root sheath, a covering around the hair follicle. You consult your books or ask your doctors, they will tell you that every hair root has two sheaths around it. These are protective sheaths. They contain stem cells, melanocytes, fibrocytes, and a lot of things. Now, these protect the hair follicle, the dermal papilla. The dermal papilla, which contains those dermal papilla cells which are going to stimulate the stem cell to multiply and to form more new hair. So the hair root sheaths, what the recent science and the recent research is saying, the hair root sheaths become weak or old, you can say. And as they age, the stem cells from the hair root, it actually escapes through the gaps in those root sheaths. So this thing one has to remember, the hair stem cells which we earlier used to think that they die off, maybe they get old and die off and then they can't make new hair. Or maybe the DHT damages those stem cells and that's why they can't make more hair. It's not like that. It is the most important thing will be the hair root sheath. It keeps those stem cells protected. DHT can't really go and damage it unless it becomes weak. The moment it becomes weak, DHT will also go inside. Pollution, stress, all the harmful chemicals and hormones made in our body or from outside, they'll all penetrate. They will damage the stem cells or dermal papilla cells at that stage. Apart from that oxidative damage, because of this hair root sheath becoming weak and porous, stem cells will escape from here into the surrounding skin, which has more nutrients for them to stay healthy. So it is basically a lack of nutrients in the hair roots also which are affecting this. This I call the great stem cell escape, and it has been documented by scientists, and you can ask for the description. I'll be happy to share it with you. Now, how do we control it? So current medicine says you use DHT blockers. So there are many DHT blockers and some of them are quite harmful also. There is finasteride which has its own set of side effects. And secondly, we see that these DHT blockers don't work every time. In my practice, I have seen them to work in less than 10% of the cases. So what is happening here? What is happening is that the actual cause is not being corrected. We are just focusing on trying to lower the DHT levels. We are not reinforcing the root sheaths. We are not providing them antioxidants or other things which will prevent the oxidative damage to the hair follicle cells. So this is what, like you see in this diagram, you see a young hair follicle. There is the root sheath, there are the sebaceous gland, the stem cell just below it, the melanocytes also. The melanocytes actually give color to the hair follicle. Now as the hair follicle, if you see in the diagram, as the hair follicle starts aging, there is a lot of oxidative stress and it starts from the root sheaths, from outside inwards. And then you notice that a lot of cells become senescent. Now senescent or senile cell, basically as the name suggests, the cell becomes old, injured, and it doesn't die off. You can call it a zombie cell. It secretes all harmful chemicals and turns the cells around it also into senescent or senile cells. So in this way, the hair follicle, in response to stress, first of all, its melanocytes age or die off or become senescent, and that results in a dry, weak hair, a white hair also, and a progressive miniaturization of these hair as these senescent cells start affecting the stem cells also. They form many cytokines, many inflammatory things which affect the cells all around them. In fact, if you see under a microscope, you will find, the doctors will tell you that there is a inflammation, underlying inflammation in that area during androgenic alopecia.